Okay, fantastic. All right, well, welcome everybody. Thanks so much for joining us this afternoon to talk about the CDC and careers at the CDC. I'm really excited about this panel because I had the chance to travel to Atlanta earlier this year. I went down for the American Public Health Association conference, and while I was there, I got to meet two of our panelists and heard a little bit about their careers with the CDC. They're also alums of Lehigh. So we have 5 panelists, 3 who are alums of Lehigh, 2 who are generously volunteering their time to teach us all more about careers and their path in the CDC. And, you know, just the opportunity and the importance of the work that the CDC does seemed so important to me to make sure that we were conveying that opportunity to our students. And so for panelists, our students in the College of Health right now are either majoring in, if they're undergraduates, they're majoring in population health, or they're majoring in community and global health. And then at the graduate level, and I see we do have some graduate students who have joined us, we have a Master in Public Health, and then we have an MS PhD in Population Health. So that's kind of the background they're getting. So all of our students are going to have, no matter what their major or graduate program, they're going to have an understanding of the multiple determinants of health. They're going to have some kind of background in statistics, biostatistics. It might be, you know, anything from statistical literacy, so pretty basic, all the way to, you know, programming in R and Python and getting involved in machine learning for health. So there's quite a range. And they're going to have some sense of how the healthcare system works, you know, in the United States. And some of them are very interested in the global picture as well. So we have this kind of range of students who've joined us. So I want to start out just by telling you who's here and what their titles are. And then we're going to jump into maybe some participatory-ish a start to this. So it's a little more lively than your standard Q&A panel. But so I'm really pleased to be joined this afternoon by Rachel Katcher, who graduated from Lehigh in '94. She's currently a health scientist in the Division of STD Prevention at the CDC. Welcome. I also, we're joined by Naomi David. So her camera's not working right now, just so you know. She may pop up once that technical problem gets solved, but she graduated from Lehigh in 2012, and she's currently a public health advisor, and she works with both the Global HIV and TB Global Tuberculosis branch and the Division of Overdose Prevention, Epidemiology, and Surveillance branch at the CDC. So we are joined by another guest, Gabrielle David Heiser, who is a public health advisor with the National Center for Immunization and Respiratory Diseases based in Chicago. I should say, I believe both Naomi and Rachel are based in Atlanta. So Gabrielle is based in Chicago. And then we also have joining us Natalie Sutherland, who's a public health associate. And this is a really cool program that we want to be talking about tonight with everybody. So we're really happy she's here. We have a couple of graduates of that program too, who I've already mentioned. And she's currently assigned to the Virginia Department of Health, working on maternal and child health in Richmond, Virginia. And then about 5 o'clock, Kara Beck will be joining us. She's a Lehigh graduate from the class of 2012, and she's currently an ORISE fellow. So that's a whole different kind of program and way in to the CDC. And she's currently working for the Division of Heart Disease and Stroke Prevention. So I want to get started by asking all of you who've logged in to write something quickly in the chat. What do you know about the CDC? Like, just tell me one thing you know about the CDC. I'll tell you, when I met with Rachel and Naomi, I learned a lot, and I thought I knew stuff, and there's a lot I didn't know. And so I'm just want to give them an opportunity to fill in some blanks for us before we dive into what a career at this place might look like. So I would just challenge everybody in the call. Everybody should be able to say something, right, about this. So go ahead and drop that. I don't know, Monica, if it should be in the chat or in the, you put it in the chat, that'll work instead of Q&A. What do you know about CDC? I will not say your name. How about that? So you don't feel like it's a dumb thing to say. There are no dumb things. We're going to be here a long time tonight if that's what you know.
I know. Come on, guys.
Okay, we
Oh,
have
somebody-
something.
We need to put it in the Q&A, not the chat.
Oh, I'm sorry.
Okay.
Thank you. I'm so sorry. Great. So go ahead and put it in the Q&A. That would be great. Sorry, the chat was disabled. Okay, interesting. Okay, so we have one person who says that the CDC approves medicines to be used by the public. Any thoughts from the panelists? Is this accurate? What would you say to that?
Well, this is Rachel, and I would say we actually provide a lot of evidence for other agencies or like the ACIP, which I'm trying to remember what it stands for, the immunization panel, to make decisions about what medicines are approved or what practices we take in terms of like immunizations or even in STDs, what type of guidance we provide. So oftentimes it's more the research side than the approval side.
So it would be probably the FDA who would be doing the
Yes.
approvals on most stuff, but y'all are providing the, what they need to make a decision.
Absolutely. Yeah.
And guidance for how you might use something once it's approved even. Yeah, okay, cool. So another thing you guys do is develop disease prevention. Sounds, yeah, that
Sounds
seems
like our bread and butter. Yep.
Yeah, I was going to say that exactly. Yeah, that is like, yes, you got it. You conduct research on minimizing health epidemics, diseases, and more. Yep. Awesome, guys. You do disease surveillance.
Yep.
Yep.
That's another major thing we do.
You help communities across the nation prevent illness and disease. You provide accurate health information to the public. You've been responsible for the large amount of policies that guide current health practices and protocols, and they also do research and put it into action. Yeah, you guys are good. This is an informed crowd. I love it. CDC uses science-based approaches to promote good health and well-being. They can focus on disease prevention and guidelines during a pandemic, for example. Okay, awesome. All right, now to the folks who are on the webinar, tell me what questions you have. So what don't you know about the CDC? So you guys have a good sense of the mission. Do you have any questions? Like what's something you would want to know? Okay, well, maybe more of that will evolve as we get going here. So thank you guys for participating. It makes it more fun. Oh, I love this one. How can we work at the CDC? Yes, that was kind of the point of this. So so I love that. And why don't we get to that after, we'll definitely get to that. Promise we're answering that. That's kind of our main point. So perfect. So what I want to ask each of the panelists is, what do you do at the CDC right now? What's your current role? And what does that mean? Like day to day, what are you doing? So anybody can just start us off.
I can go. Hi, everybody. I'm Natalie. I am working for the CDC and I'm a part of the Public Health Associate Program. So right now I am a Public Health Associate and I got placed at the Virginia Department of Health, and my role there is the Baby Care Program Consultant. That's a home visiting program for maternal and childhood care. And day to day, I'm working utilizing public health frameworks to create more structure, build relationships between all of the health districts in Virginia that have a baby care program. And that's about 12 districts that I'm working with. And just being able to reframe the rubric so that it can become more evidence-based and result in more funding for the program.
Great, that's really interesting. Thank you. And I'll just say, can you just tell us a little bit more about the Public Health Associates program? I think that kind of is a beginning answer to that question of how do we work at the CDC? Yeah.
Yes. Okay. So I went to Virginia Tech, and when I graduated from Virginia Tech, I had an internship with Health Career Connection. And after that 3-month internship, they would still continuously send out emails about job opportunities, fellowship programs. So about a year later, I get an email about PHAP, and it was an application. I think it was open for about 5 days. I applied for it, and then about 8 months later, I figured out that I got in, and it's pretty much a program for people who don't have a lot of work experience in the public health field. So it's a great program for recently undergrad students, as well as people who recently graduated with their masters to get their foot in the door. It is a very competitive program, so I can't tell you guys exactly how to get in, but I do have to say, just having a competitive resume, and it's really about who you know as well, because I was connected with somebody, a part of the PHAP program, before getting in, and it was great being able to connect, really open up your networking, because you never know who you may meet that can put in a good word for you throughout the program. And I think Gabrielle can also back me up to talk more about PHAP, because I am only on month 3.
Oh, wow.
being
And
part of the
how long will you be in PHAP?
I will be in PHAP until November 2025.
Okay, so is that about 2 years?
Yes, it's a 2-year program, and in June of 2025, I will graduate. And if given the opportunity to convert to a full-time job long term, I'm able to do that conversion before November. That's another thing about the PHAP program. It is not a guarantee that you will have a job after you graduate, but it does look good on your resume. And honestly, having one foot in the door is going to be really helpful in the long run.
That's great advice. And I'm going to ask a blunt question that students might be thinking. Do you get paid during the PHAP program?
Yes, so we do get paid, and for previous years, you can pick to be GS5 or GS7, and these salaries you are able to look up online, so it's very transparent about how much you're going to get. And I do have to say that when you do apply and you're applying for a higher pay level, if you don't meet those requirements, it is an automatic. You're not going to be given the opportunity to move forward. But after you work in each pay grade, I'm pretty sure for 52 weeks, the second year, if you start at a GS5, you'll go to a GS7. And if you start at a 7, you'll go to a 9. So that's really important when applying and picking where you want to live. Because if you're somebody like me that lives in Richmond, Virginia, if I pick to live in New York, I may be getting paid a little bit more, but the cost of living is also higher. So it's definitely great to take into consideration your financial life and how you are with that. For me, I didn't have to move at all. I'm from Richmond. I stayed in Richmond, and you also have the option to tell them if location is more important than the topic that you get placed, or you can say it's more important that you get the topic over location. But you do get paid. It's very transparent, and it's just a personal decision if it's enough for you.
That's really, really helpful information. Thank you so much. So I am going to take your suggestion and jump over to Gabrielle to ask, what's your experience? What was your experience? Well, let's start out with what are you doing now? And then maybe what is your experience? What was your experience in PHAP since you're a graduate of that?
Sure, absolutely. Thanks for having me here. So I am a public health advisor with the National Center for Immunizations and Respiratory Diseases, and I'm placed in the Chicago Department of Public Health Immunization Program. So the great thing about being a public health advisor in this field is that I do not always get it set day to day. So I'm currently one of the people in charge of managing our CDC grant and activities, and this grant season is coming up. So I have been getting busier by the day. I also get to help out a lot with our immunization clinics. So one recent one that I went to was geared towards the migrants that have been in Chicago. So it can be very fulfilling in that regard. Outside of that, I do some quality improvement efforts. I track where we are in our projects, and I work really closely with the Vaccines for Children's program. which is a really excellent federal program. Everyone should go look that up. So yeah, that's pretty much what I do for my day-to-day. And in terms of PHAP, so I went to Westchester University, and I kind of always wanted to work for the federal government. I never really thought it was an option for me, but eventually I found myself in my senior year looking up federal programs, and PHAP, like Natalie said, is geared towards specifically future public health professionals that are looking to have a federal career. So I put all of my eggs in one basket, which I don't recommend doing, but for some reason, that's in my nature, is to just, decide one thing, or if it doesn't work out, I'm going to go join the circus. Anyway, I somehow got into the program, and then they put me for 2 years. I was with the Pennsylvania Department of Health Division of Immunizations, and I started in 2020. So if you ever want to ask me any questions about what that was like, I can happily answer any of those questions. But PHAP was a wonderful experience for me. It definitely gives you a lot of, oh, I'm sorry if you can hear that. That's my phone. My Siri was just activated by me throwing my arm to the side. Sorry about that. But it gives you a lot of opportunities into the federal government. And I told this to Natalie before too, that I knew some people who joined the PHAP program. They already had their master's degree. They were having a really hard time getting into federal service. So they were working at state and local for a little bit, but they really wanted to try the federal aspect of it. So PHAP was their way to get their foot in the door. Mm-hmm. And working in federal service definitely isn't for everybody, but I feel like you guys are all in a really safe spot right now where you're able to kind of test where you want to be. And if you want to try federal service, I think this is a really great program to do so without having a lot of public health experience. And if it turns out you don't like it, absolutely fine. There's no commitment to the end of the program. You can leave when you want to. A lot of people will go back to school closer to the end of their 2 years, maybe to law school or medical school. They might find a job at the host site that they're working on, so they leave early. But I hope that answered your question. Sorry, my Siri threw me off for a second.
No, that was great. Thank you. Really additional helpful information about PHAP. And yeah, so we have a question. Someone would appreciate if the full program's name can be spelled out, and I can actually type that answer, but I think it's going to only go to one person. I'm not sure how that works, but I'll try it. So it's the Public Health Associates Program. I believe, no, I'm going to send this, and you guys tell me if you can see this. Can everybody on the webinar see it? I guess I don't.
Oh, no, it's only for the panelists. I'll have it on the slide at the end.
Okay, perfect. Thank you. That's fantastic. Yeah, great question. So yeah, so I think, maybe we'll move to Naomi now, because she also was in PHAP, and then but has been out for 10 years, and so then has this path at CDC since then. So can you kind of tell us that story about your experience in PHAP, and then like what's going on now? What do you do day to day?
Yeah, and hi everyone. So I'm Naomi David. I guess I can talk first about my current role. So I'm a public health advisor, and I have a role at CDC called Project Officer is one of my main roles. So I work directly with cooperative agreements, which is kind of another word. It's a type of grant. So it's one of the ways that CDC gets funding out the door, because CDC funds a lot of state health departments, projects with ministries of health, working with NGOs. So I work in global tuberculosis. And I work with a variety of, I do some NGO work that does work in several different countries doing global TB surveillance and prevention efforts. And then I also work with some ministries of health directly, some of our CDC country offices. For those that don't know, CDC has, I think, almost 60 country offices around the world. So that's also really helpful for our global health efforts. And then a lot of what I do is kind of project management to make sure that they're fulfilling, what's agreed in the cooperative agreement, whether it's submitting data, doing surveillance stuff, prevention work. And, each of my cooperative agreements kind of operate differently. But that's a big part of what I do right now, my day-to-day tasks. And yeah, as mentioned, I was part of the PHAP program. So I joined in 2015, right after my master's. So I actually did go the route of doing my MPH, not really sure what I wanted, but I knew I was interested in CDC, and I had considered, ORIs and contracts and a few other avenues. There are several ways to get into federal government, and, lots of different levels of government and public health too. But yeah, I was placed in Nashville at the Tennessee Department of Health, and I worked in enteric disease surveillance. And I don't know if this has changed about the PAP program, but when I was offered my position, I had 48 hours. I was just told the city. I wasn't told what I was working in. And I said yes. And then I found out it was enteric disease surveillance. And I said, I don't want to work in that. Can I have something else? And they said no. And anyway, I had a wonderful 2 years. I learned so much. I got a really great epi skills. I loved working at the state health department level. And it was a really good experience. So just another plug also to say yes to opportunities, even if you're not really interested in the pathogen.
That's great. That's right. That's really great advice. Yeah, I really appreciate that. So I wonder if anybody on the colony when attending the webinar has any more questions about PHAP, because we're going to sort of pivot a little bit. We can always come back to it, but if you have something in mind, so we'll definitely highlight the program on the last slide so you can check it out. I believe applications are closed for this year. Which raises another thing. So how long after your degree can you apply? I think there's like a window of time after you complete a degree that you can apply. I don't remember what the window is, but I remember reading that. Don't know if anybody knows that.
I think off the top of my head, it's 2 years.
Okay.
Someone will have to fact check me, but I'm pretty sure it's within 2 years.
That's right. It's 2 years.
Yeah. So if you're on the call and you're a junior, great. Look for the call next January. It usually is. And I think somebody mentioned there's like a 5-day period, maybe it's Gabrielle, a 5-day period where you have to get the application in. So you want to keep your eyes open for that. And it sounds like there's quite a long, or maybe it's Natalie, there's quite a long time until you get an answer on that application. So that's good to keep in mind. And then if you're graduating in May with either your master's or your bachelor's degree, the window's closed this year, but you'll still have time to apply in the next couple of years. So that's good news. All right. So I don't see other, oh, interesting. Okay. So here's a question. When you're in the PHAP program, for those of you who did that, is your work more qualitative or quantitative?
I can kind of touch on this really quick and then somebody else can talk about their experience. So if you go to the PHAP homepage, there's actually a list of core competencies that the program makes sure that every associate gets. And that is in part to have qualitative and quantitative skills. So what happens is you are applying for the PHAP program, but so are the host sites. So they're telling PHAP what type of assignments they want their associates to work on, and they're making sure that those associates can meet all of those competencies. PHAP also allows there to be training throughout the 2 years. So I know they do DISC. I can't think of any others off the top of my head, but they make sure that all associates have those types of experience. So you would be doing both qualitative and quantitative data to some capacity. I don't know if anyone else wants to take over, but.
Any other thoughts on that? Okay, great. Yeah, Naomi.
Yeah, I was just saying, no, that's totally right. And there's going to be a really big variety, I think, of different PHAP placements and types of positions. And I'll just say personally, I had both quantitative and qualitative data in mine. So I was in foodborne outbreak response. I was doing epi skills, trying to figure out what foods made people sick. And I was also doing qualitative interviews asking about their symptoms. So there's a wide range at the local and state health departments.
That's great. And this is a great question. Are international students eligible for PHAP? Do you guys know that?
Yeah, I know I had, not all the students were Americans when I was in the program. So assuming those are still the same. Yeah.
Okay, that's great. That's great news. Yeah, thank you.
I did want to say something.
Sure.
With the PHAP program, at least for my class, it is very diverse. It's so many different types of people. And I think that's when I met everybody in Atlanta for our orientation, it was so great because it felt as though there wasn't a minority group. And I've never felt that before in any job, fellowship, internship. So I do have to say it's wonderful in that area.
That's great to hear. Yeah, and that's, College of Health at Lehigh is more diverse than Lehigh as a whole. And, you know, I imagine that that feeling of not being in a minority was kind of transformative, you know? So thank you for sharing that. So we have another question about PHAP. So this is from a person who is earning her master in public health, I believe. I recently applied for the PHAP. Good job. Can I do anything during this time to help improve my chances of getting into the program? It's a good question.
So I can answer this a little bit, a kind of a half answer. So I love helping anybody that is interested in the program. I shared my email address. If that email address can go out, please feel free to email me. I've talked with 2 other pre-associates before to get into the program. I think 2 of them got in. There's nothing I think you can do at the moment because I think you just submitted your resume, if I'm correct. So PHAP has different stages in their application. So I believe the next stage you will be writing a little bit more about yourself. Natalie is nodding her head, so I'm assuming that's a yes. So my biggest piece of advice is just to be really passionate about why you want to be in the program. Like, what is it that makes you want to join? Why did you get into public health? Let that passion come through, and don't be afraid to say that, because public health advisors are very passionate people. We care about the work we do. Sometimes the work we do is really challenging and we have to be really flexible. So just make sure that's shining through, and I'm here if anyone wants to email me afterwards. But good luck.
That's nice. That's great.
I also wanted to piggyback off of Gabrielle with what she said. Keep in mind that because this program is meant for people who don't have work experience, it's okay if you make it to the interview phase and you don't have much to talk about in that area. So definitely your passion. During my interview, I was definitely very nervous because I was so stuck on like, oh, I haven't worked a job in this area, blah, blah, blah. But definitely also look at the best fit acronym that they have for who is best fit for the program. And really, when you answer your short answer questions, if you make it to that phase into your interview, hit on as many of those as you can.
Good advice. Yeah, really good advice. So someone asked also about PHAP. What are the majors or concentrations that are a good fit for PHAP?
Any major, like it in the application or on the website, it says you can be a music major and apply for PHAP. And the people in my cohort, and I'm pretty sure Gabrielle and Naomi can also agree, not everybody has the same career goal. There's doctors, lawyers. I mean, some people are just doing this to make money for the next 2 years. And then if it goes to having a career in public health, they'll do it. But if not, then they're doing something completely different. So definitely your major is not something that should have an effect on your chances of getting in. It's really just, are you passionate about what CDC's mission is?
Cool. So yeah, Naomi.
Oh, well, I was just going to jump in and say that when I was at Lehigh, I didn't even know what public health was. So you guys are all way steps ahead of me. And yeah, I kind of fell into it after college and just the whole field. But yeah, you guys are already ahead of the game.
That's great. Thank you. Yeah, that's really helpful. So I want to switch now to, think about a different approach in and also just different career paths. So I want to switch over to Rachel. So you've been at the CDC for a while, and my understanding is that you had an ORISE fellowship as part of that, which Kara now has. So we'll kind of link you two up. But if you would start, Naomi, Rachel, that would be great. Just tell us a little bit about what you do right now. And then if you will, give us some of your path, from college to this point, which I know is a lot to cover maybe, but
I'll keep it short though. But yes, definitely. So I'm actually a health scientist in the Division of Sexually Transmitted Diseases. And my title is health scientist, and that's more of a science-based role. So my job consists of designing and conducting studies, analyzing, interpreting data, writing papers, and I use mixed methods. So I use both qualitative and quantitative methods in the work I do. And because I'm in STDs, it really is a broad range of things that I do. We're a very small division that's not funded very well. So I actually get a lot of flexibility in the work I get to do. I get to work with the public, which is not something all the time that we get to do at the federal level. I think it was Gabrielle was saying, we push a lot of money out the door. Like 70% of our STD budget goes out to the states. So oftentimes you're removed from the work, but because I'm in a smaller division, we get to interact with the public generally. But I, like Naomi, I didn't know about public health when I graduated from Lehigh. And at the time, I just read The Hot Zone, which is this old book about Ebola and the CDC. And I was just like, oh, this is what I want to be doing. But even when I read the book, I didn't realize it was like, there was this thing called public health. And I had moved to Atlanta and realized that I need to, for me personally, because at the time, this is again in the 90s, there were no undergraduate programs for public health. So I went and got my master's at Emory and through an ORISE fellowship. So we put out a lot of money and can hire a lot of people in on these ORISE fellowships. And a lot of people come into our agency through like PHAP, ORISE, other types of fellowships. And there's actually a website. If you Google TDC fellowships, we have a really nice webpage broken out by, what educational level you are, what you're, it's just really well done actually. But so I ended up getting an ORISE fellowship, and those fellowships are usually around 3 years, but they can extend out to 5. So then when the benefit, like as everybody's already mentioned, is that people get to know you and they get to work with you. And so when I applied for a position at CDC, people already knew who I was, right? And I also knew what the position was looking for, I had an in to know what they wanted, which is much harder than if you're coming blind from the outside. But the nice thing about this panel right now is you now have access to us to help you with it, because one of them, so not only through fellowships, but the other thing you should do is get onto usajobs.gov. That is the only way to apply for full-time positions at CDC. If it's not a fellowship, you have to go through that system, and they don't make it easy. And there's tricks to how to do it. I think the biggest advice I could give you if you go through USA Jobs right now is to like literally match what they say in the job description and make sure those words are on your resume and in your because it has to go through HR first, and HR, they are not the scientists, they're not the health communicators, they don't know the positions as well. So they're looking for, if qualitative is in the position description, you should have qualitative in your resume at a minimum. There's other tricks that others probably have a better handle on because I've been at the agency for so long. But so yeah, I think that's how I ended up at CDC, and I've loved it ever since.
That's great. Yeah. Thank you. That's awesome. And Kara, so you're just starting an ORISE fellowship. Can you tell us more about that? What you're doing now and how you got there? Yeah.
Yeah. So I am currently an ORISE fellow. I started my fellowship almost 2 years ago now. My path to public health was a little indirect, where similar to Naomi, by the time I graduated from Lehigh, I was really interested in poverty and economic development and where that intersected with health. And kind of by the time I graduated, I was like, oh, there's a whole field for this. I started working more on the direct social services side. So I worked for several years in helping people apply for public benefits. But in doing that work, I got more interested in the working at the public health research level because I could help someone get health insurance, but I couldn't do anything about the fact that there were no doctors in their counties that took Medicaid. So I was really interested in studying, being able to better quantify those problems and identify solutions. And so that led me to a job as a research assistant at a public health research group in Philadelphia. Yeah. And then in trying to find where I could best fit into the field of public health research, I focused in on biostatistics and did my master's in 2021. And with ORISE, you can apply within 5 years of your terminal degree. And I was really interested in getting that period of additional hands-on learning and felt that you get in an ORISE fellowship. So I that's how I got here now. Did I fully answer the question?
Yeah, I think so.
Okay.
And so what are you doing day to day right now?
Oh, day to day. So again, so my field is biostatistics, and the majority of my work is doing research projects. So day to day, that looks a lot like a lot of statistical coding, but sometimes things more like, literature reviews, writing manuscripts, things like that. But also because ORISE is focused on training, as training opportunities come up, I'm able to kind of jump on those, and those can be prioritized in my schedule. So it's nice.
That's great. And just highlighting, Kara mentioned the Public Health Management Corporation. That's who she worked for in Philly, I believe, based on her bio. And we've had other students placed there for internships, and for students who are on the call, if that's something of interest, we actually have funding. If you get an unpaid internship, the College of Health can fund you for the summer while you do that. And so that's something to follow up with Jen Top about, to sort of look into that opportunity. So not related to the CDC, but a possible, path in a way, right? Toward exploring this area. So that's great. So we have a question about the ORISE Fellowship. And does anybody know what that stands for? The ORISE?
Oh, I do.
Yeah.
Yes, Oak Ridge Institute for Science and Education.
Okay, yeah. So the Oak Ridge Institute for Science and Education, the ORISE Fellowship. And the question is the ORISE Fellowship program more research-based? It's
I would say so. Like the whole my understanding of its whole kind of reason of being is to get scientists and people in STEM and healthcare like hands-on training in their field early career.
yeah.
And they're actually really adamant about, when you sign on for it and being like, you are not an employee of the CDC. You are doing a research project here. Like I'm not allowed to do anything administrative or, budgeting or anything like that. As a fellow, I'm really supposed to be working only on my research projects.
And I think the word research is really, we use it pretty broadly at CDC. So like you're Kara's in biostatistics, but I've had ORISE fellows for behavioral science projects, for communication science projects. You could be in the lab, you could be doing like epi stuff, epi and surveillance. So I think it's really what the need is for the program at the time. So it's really all over the place, but it is to be a training program.
And then do you apply into a specific topic fellowship, like you're applying for one thing, or are you applying to the program?
No, so ORISE is really, I would say really decentralized, right? Like it's a broad umbrella, and there are ORISE positions across a number of federal agencies. And the thing about ORISE is that it is very placement specific. So if you are applying, I'd recommend, usually your mentor for it will be listed on there. I'd recommend like looking them up and kind of looking into who you'll be working with, because it's very placement specific. You know what I mean? There are broad things that are required of it, but in terms of sometimes like how much mentorship you'll get or how involved your mentor will be will really vary on who they are and what the role is that you're doing.
Okay, that's really helpful. Yeah, thank you. So any other questions from attendees about ORISE? Looks like not right now. So we do have a couple. Hopefully we're starting to answer the question, how can we work at CDC? So we have a couple of ways in. One is through the Public Health Associates Program, PHAP. The other would be through an ORISE fellowship, which doesn't mean you're working for CDC, but you're getting to know the work so that you're in a position to apply. And then there's going to the usajobs.gov and just cold applying for a job that might be out there. So, I mean, that's kind of what I've learned so far. So we have a question about, this person says, I'm really interested in global health. How does the CDC work to solve health challenges internationally? And so I think Naomi started to address this by telling us about, that there are offices in 60 countries, but can any of you guys say more about the international footprint?
Yeah, I can start to answer that. First off, I think that is probably a difficult question to answer broadly, and I think it does depend on the pathogens in different areas. But I'll start by saying a lot of our funding from the US federal government that goes into our country offices and working with other countries is through the PEPFAR program, which is HIV and TB focused. So that does fund a lot of our country offices and a lot of the coags that work in HIV, globally. But I will say on a larger scale also, a lot of what we do is planning with other, agencies in other countries or like WHO. I've done stuff with WHO and the UN, because especially when it comes to policy or recommendations, there's a lot of coordination on different levels. So I hope that starts to answer the question. But yeah, there's a lot of collaboration at many levels of government. Thanks.
Great. Anybody else want to add anything? Things that are going on globally?
Yeah, I mean, to piggyback off Naomi, we're really involved. There's little we're not involved in, especially when we think about infectious diseases. That's really, I think, where we are more than you would think about like chronic. So, we're actively trying to stop polio and like any disease you can think of that's infectious, we're probably involved in it. And as probably most people are aware, we really do live in an international world. And so anything that's happening in one place could affect us, just like COVID did, just like monkeypox, which we now call Mpox, has. I mean, we have to deal with outbreaks all the time. And if we can support within those countries, we actually end up protecting ourselves as well, because if you can contain it, it's not spreading. So the CDC actually has not just people stationed everywhere, but they do have, I can't remember what it's called. One of you guys will have to remind me, but our international colleagues want to come home sometimes. And so we have programs where you can go for like 3 months to backfill for somebody. So you can get experience working in Mozambique, for 3 months, so somebody can come home and like see family and take care of like other things that they need to do. So there are opportunities once you're in the agency to do some international work.
That's great.
Yeah. So I'll just add too, and in addition to, doing details and backfill like Rachel mentioned, it's kind of all hands on deck when CDC has emergency responses. So, I've worked on Zika and COVID. A lot of colleagues worked on Ebola and did deployments. And so there are a lot of opportunities, which is one thing I really like working at the federal level, is getting to be a part of those emergency responses.
That's great. Thank you. So we have a question specifically for Kara. So this is from a student who says, I'm applying for my MS in biostatistics currently, and I do not know what I want to do after. So what made you decide to apply for ORISE and not do a PhD or get a job in industry after graduation?
That's a great question. I was really interested in having a period of time where I could be working, but it still be that learning environment. Like I wasn't sure yet that I wanted to fully commit to, another 5 years in a PhD program. And I wasn't entirely sure yet the field that I wanted to work if I did want to pivot to industry, because I knew that I've since graduating Lehigh, like I've wanted to work more in the public health realm. So I just kind of saw that as a great opportunity to still be building my resume and my practical experience, but in a more supportive environment than just starting a job and needing to fulfill the job's role as opposed to my own kind of learning goals.
Great. Yeah, thank you. Thanks for sharing that. So we have another question for anyone. How related are the CDC and the CDC Foundation? Interesting question. Anybody take that one?
Yeah, I think this is another hard one, and maybe Rachel or others can weigh in too. So I've worked with CDC Foundation in a few different capacities. So my understanding, so the big difference with CDC Foundation is it can be donation based. So it's not, congressionally appropriated funds. Because of that, CDC Foundation has the ability to do things that CDC can't easily do, whether that's working on certain communications or hosting events that like really help at, maybe like almost like a lobbying level sometimes. So, I've worked with CDC Foundation for helping staff up opioids data analysts in states rapidly, because it's also a mechanism to quickly hire people. So you don't have to go through CDC jobs, or sorry, USA jobs. And I've also worked with them to plan a party to go alongside the UN meeting in New York in September, because they were allowed to spend money on alcohol while CDC can't. So that's a gray area, but They do a lot of support. So I would say CDC Foundation works very closely with CDC. There is a lot of employees there that also worked at CDC at different points. And it really looks, I think CDC Foundation works with CDC on a cooperative agreement basis. So, there are going to be different tasks for a certain agreement that are completely different and unrelated. But with that said, I think there's also a lot of job postings on the CDC Foundation website that are worth checking out.
Great, another great tip. So we have like a fourth, kind of path in there, which is interesting and helpful. So what do you guys like the most, each of you, about working at the CDC? And then I'm going to ask you what you think is the worst too. So get ready for that. So what do you like the most? And I don't know, we haven't heard from Natalie in a while. So how about you start, Natalie? What's the best?
I don't know. I feel like with me being so young, the best thing for me about working for the CDC is just like, I feel like this is a lot of public health passionate people's dream to work for. I
Yeah.
love their mission. Like I mentioned earlier, the diversity, because sometimes it's not just about what you do, but the people that you're around. And it's so great to work for an organization where majority of the people around you are also as passionate, maybe even more. And because there's so many different sectors of the organization, you're also becoming more educated throughout your time while being in the program. So I do have to say, I look forward to all of those things over the next 2 years and possibly even after that.
That's really great. Yeah, what would you say, Gabrielle?
Have three things. So the first, going off of what Natalie said, it's the people. So before I joined the world of public health, I was in healthcare for 10 years. So I started when I was 17 and just kept going in different roles. I don't know if anybody else on the call has ever felt this, but sometimes when you're talking to a healthcare professional about public health, it doesn't match. And even in your personal life, you can talk about preventative care. It's just not happening. CDC is full of people. All they do is that. So it makes conversation so easily. I feel like once I started CDC, I actually made some of the best friends, specifically in the PHAP program, made some of the best friends I'm going to have for the rest of my life. Like if that is your energy, I think you'll be in good company here. The next part about CDC that I really, really enjoy is the flexibility and the amount of opportunities that you get. Something that Naomi touched on was about detail opportunities. So I think that being a public health advisor, you get to be so flexible in what you get to do that once you talk to someone, be like, oh, you're a public health advisor, you do X. They could be doing something that you've never heard of before. I know in PHAP, there's a couple of associates that usually get placed in like Alaska. They're going to be going on planes. They're going to be doing things that are going to be so much different than, say, the Philadelphia Department of Health. So I think there's some great opportunities wherever you go within the agency. And I think that I forgot my third point. So yeah.
That's great. No, I think that's great. If it occurs to you, jump in, But so Rachel, what do you like? What have you liked about working at CDC?
Well, I have to also echo just being around people who have the same passion. I mean, we are not in this for the money at all. We're considered a noble profession, but everybody who wants to be doing public health is doing it together. So that is just an amazing thing. But we also get to work with some of the most brilliant minds. I mean, few people realize how many therapeutics CDC actually has developed, and then we give it away to a private company who then profits off of it. But we have people thinking about these topics and are so well versed in such subject matter experts. You're surrounded by brilliance, and you add in the passion. It's just a great, for me, has always been a great place to work. And again, the flexibility, once you're in the agency, you have this ability to do what we call details, and you can apply to work in different areas. So you really can find, if you're into chronic diseases, like if you want to do seatbelt health, or if you want to be doing, something like enteric diseases, you have these opportunities. So I just, it's all of it. It's the compassion and the passion and the camaraderie and the brilliance, really.
That's great. That's great. And it sort of raises a question. I know there's some people on the call who are interested in addiction and preventing addiction, treating addiction. Can you guys talk about what's the CDC's involvement, say the opioid epidemic, or just really what would be a role for someone who's passionate about preventing or treating addiction? Anybody can jump in.
Yeah, I can answer from, I guess, the CDC perspective. So I was part of the opioid overdose program from 2017 to 2021. And so actually the program changed a lot in those years. We quadrupled in the number of staff we had.
Wow.
And then we started a program called I think actually there's a new name now, but it was Overdose Data to Action, where we worked with 49 of the states and a few territories and then 19 cities. And we were funding them to do different surveillance and prevention efforts. And, that looked really different on different states because, as people probably know, there are different laws about, different harm reduction efforts across the nation. And so I think there's also just, not all addiction and even the drugs that people are using are the same across the country. So there's a lot of really specific needs. And what I loved about that program is, we were giving a lot of funding to state, city, and local health departments. So while they were submitting the data that we requested and, we could look at things from a national lens, they also had the autonomy to make their own programs for their local level and to decide, what do we want prevention to look like in our state, or what kind of harm reduction efforts do we want to make? So that's something that I don't think I really understood until I joined CDC, is how intertwined they are with the state health departments. And then how the city and local health departments are really supported by the state health departments. So, it kind of comes top down, which has its challenges too, but I'll stop there. See if anybody else has input on the overdose program.
I was going to say that another PHAP associate that's in my cohort, she got placed at a host site that hits on drug addiction. And with the PHAP program, there's so many different topics you can pick. And I see a question about mental health.
Yeah.
There's a host site for mental health, like anything you could probably think of. For the most part, there's a topic that you could possibly get placed at to be able to work on it for the next 2 years.
Yeah, that's great. So does anybody have any more kind of knowledge about the work around mental health?
I know in STDs, we consider it like a social determinant of health, essentially, because that influences the decision making and behaviors that you engage in. So if you're not taking into consideration mental health, you're missing a piece of the puzzle.
Right. Yeah. Awesome. Thank you. So best thing about working for the CDC, Naomi?
Yeah, I like this question. And the one about dislikes. I think this has already been hit on, but yeah, just the diversity in options of experience. I've had a lot of variety in work in my 9 years here. Like working with tribal nations during COVID vaccine rollout, or entering data on the night shift in Puerto Rico for Zika. I've gotten a lot of really cool experiences. And so that's something that really attracted me to the agency, and just the chance to kind of be on the world stage. So even though we're US federal government, we really are on the world stage for public health, which is pretty neat. Kara?
I've been thinking about this, and my answer is, it's going to sound like everyone else's. But I'll start with I think one is knowing that I'm contributing to good work. I don't think I had mentioned this earlier, but I'm within chronic disease. I'm in the Division of Heart Disease and Stroke Prevention. So a lot of my studies are looking at, like, how do we, what's the geospatial distribution at county level cardiovascular disease death rates. So knowing that I'm contributing to important work, I think, is one of my favorite things about it. But also the people. I feel especially lucky because ORISE, in being more diffuse, it's different from PHAP, where you don't join with a cohort, you join as an individual fellow in your placement. And I've really lucked out that the team that I'm in, and even really the whole division that I'm in, is just really lovely people. That they're great to work with, but they're also, like, they're great to just like have lunch with and chat. So I've experienced it, and I think a lot of us have as a pretty nice supportive environment.
So thank you. And I think, knowing that the people thing cuts across all of y'all's experiences it's pretty telling. So I love that. And, we're down to only 5 minutes, and I realized what a mistake it was to think that I wanted to ask you about the worst thing and have us end on that note. So I'm going to skip that. We're not going to do that. I think that would be a mistake. And so just inviting any last questions from everybody who's attending. And then if you guys want to give any words of advice, to master's and bachelor students, I don't think there are any questions right now, but any quick words of advice, anybody can start.
I did want to mention, sorry, really quickly, Naomi, there are a lot of private companies, and I would have to start rambling them off, but that we give money to run projects for us. So that is another opportunity to work with CDC. You wouldn't be a CDC employee, but to work with CDC, and similar to the CDC Foundation, people will start at a company or a foundation or, another public health agency like Robert Wood Foundation, and we'll jump back and forth. Like they may start at Robert Wood and come to CDC or vice versa, because again, when you get to work with people at CDC, if you want to come and you're working in a different organization, they already know you and your skill set. Sorry.
Yeah, that's helpful. That's really good information. Any other last thoughts or advice?
Yeah, I just want to say, and this isn't CDC specifics, but I like to share this with, anyone graduating from undergrad or master's, and relating it to public health specifically. I just challenge you to maybe expand what you think public health looks like. I think public health happens at many levels of government and many organizations, and it's all fantastic. I was in AmeriCorps right after Lehigh, and so I was doing more public health work, working at a food pantry on the community level, which was amazing and a great experience. So I just want to keep in mind that, you can have a goal or think you might want to work in something specific, but I do challenge you to maybe have a more broad approach, and you might be surprised what is fun. I loved calling people and asking about their stools in Tennessee, and it was super fun.
Funny.
I think also along those lines is asking for, doing well at whatever you're doing, no matter what you're at, where you are, even if you hate what you're doing, just do it well, because it's going to be a stepping stone and it'll always pay off. But also asking for what you want. When I was at Emory, I really wanted to work with a particular professor, Claire Stirk. She did this really great feminist work, but she was working in substance use, which I had no interest in. And so when I went to talk to her, and I encourage informational interviews, like going and just talking to people gets you some face time and you get a lot of good advice. And I had said to her, whatever I was interested in at the time, I don't even remember. And she gave me some advice, and then I left and I walked back in. I said, I'm sorry, actually, I just want to work with you. I don't actually care about working in HIV. I want to work with you. And she's like, okay, I'll hire you as a research assistant. So, sometimes just being blunt about it will get you what you want.
Yeah, that's great. Great advice. Any other parting words?
I can say something. So the first is to take care of you. We in public health love to take care of other people so much. We're so passionate about it. We totally forget about ourselves. So take care of yourself. I said this earlier, but I'm going to say it again. You're at a really good point where you get to really experiment with what you want to do with your public health career. Don't be afraid to take up on opportunities you don't think you're necessarily super qualified for. Go apply to places. If you get rejected, learn how to come back from that. And it's okay to make mistakes. Nobody here is perfect in any type of profession. You just got to learn how to roll with the punches and grow. And I'm sure all of you at Lehigh Valley University will be absolutely incredible. Excited to hear about all of your careers in the future, even though I can't see you.
I know, it's weird not to see people. Yeah.
Can I just echo what Gabrielle said? Because when you apply to USA Jobs, you are up against thousands of people. So do not get discouraged. It really isn't about you. It's really trying to break through the crowd and knowing the tricks, because you're up against veterans, you're up against people I wanted to echo that because I don't want people to get discouraged.
I think that's great. I mean, there's so much work to be done
Yeah.
in this realm. There will be a place, you know what I mean, to contribute. So just want to say, like, as a fellow citizen of the world, it makes me feel so happy that you guys are out there doing this work on all of our behalf. Thank you so much for taking time to share that with us. I feel like we could talk a lot longer, but I know students have other things to do, and so do you. So just want to say thank you on behalf of the College of Health at Lehigh. We really appreciate it. And I guess we'll log off and say good night. Night, everybody.